All right. Thank you so much, everybody. Erika and I are both very humbled and excited to be here with you. This is our first in-person HAQAST meeting, so we're very excited to be here today. As you can see, we titled our presentation, The Power of Partnerships, Improving Milwaukee School Neighborhood Air Quality and Kids' Health. So again, I'm Carissa Hoium. I am the Environmental Health Program Leader from Children's Health Alliance of Wisconsin. And I'm co-presenting with Erika Kluetmeier. She is the Communications and Engagement Strategist with the Wisconsin Asthma Program and Climate and Health Program at the Wisconsin Department of Health Services. So I'm just going to quickly go over a brief outline of what we're going to talk about today while Erika comes up, because she's going to take the first section. Today, we're going to talk a little bit about our project background, what we're working on, tell you a really high level, big picture, all about the project. We're going to go into some more detail about a pilot that we ran in spring of 2022 to kind of as a feasibility study to make sure that this project could run the way we envisioned it. And then we're going to talk about our next steps. So Erika, I'm going to hand it off to you to talk about the background of this project.
Thanks, Carissa.
Yep.
Okay, hi everyone. I know it's after lunch. You guys might be feeling a little bit sleepy, so hopefully you will get as excited about this work that Carissa and I are about doing local community-based work. As Carissa mentioned, I'm Erika Kluetmeier. I work at the Wisconsin Department of Health Services, and I split my time between two programs, climate and health and asthma. And you can kind of think of Carissa and I working in this space as community organizers, and we're both very passionate about the work and have a lot of experience doing this work. So we're really happy to be here with you. Okay, notes over here. Okay. I'm sorry, Chris, I am not seeing the notes for the project background. Okay, well, that's okay. Just a quick history of the project, and please chime in if I've forgotten anything, Carissa. So some of you may have been at the environmental justice talk that Langston Verdeen was one of the panelists. And so Langston actually is Carissa's predecessor, and he started this program when he worked at the Children's Health Alliance and presented it to the Wisconsin Asthma Coalition and kind of got it off the ground. And when he left his position, Carissa worked with Wisconsin Department of Health Services to get it off the ground. And Carissa's going to tell you a little bit more detail. We were one of the recipients of the EPA Community Monitoring Grant funds. And so we're kind of taking it to the next level and creating a lot of partner networks to get us there. So one of the stories of Milwaukee, it's not unique. It's really a Rust Belt story. So you can probably think about a lot of northern cities having the same experience of deep segregation, a lot of exposures and health impacts, health disparities and inequities. And a lot of these dynamics persist today because of things like redlining. And just wanted to mention that the poverty rate in Milwaukee is about twice that of the national average. We have high asthma burden that I'm going to talk about in a little bit. And our Milwaukee's about just under 600,000 in population, and about 40% of our kids live in poverty. So something that we want to address through this project. So this map shows you the city of Milwaukee. If you can see that little outline in yellow, I know it's kind of faint, but I wanted to focus on the darker areas of the map that show the high asthma burden, and especially in relation to the red dots, which are elementary schools. So young kids. In terms of exposures, we have non-English speakers, air pollution exposures. We have freeways, arteries, Port of Milwaukee, 3 power plants, 1 coal, 2 natural gas, and a lot of concentration of industry. Just a quick headline to let you know that there is a lot that we understand about the problem, but that this approach really helps us understand that on the hyper local level. And I'm going to send it back to Carissa. Thank you.
We'll go into quickly just kind of an overview of the projects that we are going to be doing. As Erika mentioned, we were awarded PK funding for a 3-year, $500,000 project. It's going to begin in May of this year and run until the end of April in 2026. You'll also notice that while the funding application did not call for interventions as much as just setting up a way to monitor the air, because we're public health people, we couldn't help ourselves and we put in some interventions in there. So we'll talk a little bit about that as we go. So the project scope is really to install monitors at different Milwaukee public schools in zip codes of high burden. Then we're going to just train our partners to analyze and disseminate that data. We're going to train community members, show them how they can find that data. And most importantly, what does that data mean? How can they take action on when the air quality is poor? Then we're going to work really closely with the schools to really integrate some air quality monitoring and anti-idling campaigns into the curriculum and into student activities. Our dream is to get these students to be the champions of this work, get them really excited about it. They're going to be the great messengers to their parents. They're going to be the ones sitting in the car with their parents. Their parents have the car running for 30 minutes. They're going to be like, hey, mom, or hey, dad, why is the car still running? So we know that kids, once you get them excited about a project, they'll be really great champions for us. We also hope to share out that air quality data through apps, dashboards, websites, and also evaluate our success. So our goals and outcomes are just to look at the trends, develop action plans. We really want people to have access to that data and know what to do. And then we'll be able to show that data on a variety of platforms. And we can take a look at shorter term and longer term impacts. So to begin all of this work, when we were first putting together the grant application, we formed kind of a Milwaukee Air Monitoring Coalition. It's a whole bunch of groups of partners throughout the Milwaukee area from all different sectors. It was kind of a serendipitous moment. We had a whole bunch of other stuff going on. We have like a schoolyard regreening project going on. We have community events tied to air going on. We have right now an art museum exhibit at Marquette, all about soot in the air. So all of these things kind of came together at the perfect time to really build momentum and excitement about the project. So this group is so important because with their cooperation and collaboration, we'll really be able to move the needle further faster. So this is just for a visual. I won't go deeply into it. It just shows the extensive network of partners that we've built up to work with on this. And then we also foresee this growing statewide as we work. And we have been so fortunate to pair with other EPA grant recipients in Wisconsin. Wisconsin received 3 different EPA grants for the same funding application. Madison, the city of Madison, our DNR, and us. So we are really going to work together because we feel it would be such a missed opportunity to work in our own silos and not make the most out of all this abundance of data that we can look at all together. There's also some other people around the state doing similar work. Beloit is doing some similar work. We have some tribal nations doing similar work. We have the backing of statewide groups like the Wisconsin Asthma Coalition, who we can pull in and really gain support from. So, and we really hope to grow our work to a statewide scale using Milwaukee as our starting point and mentor others as we were mentored. We have been so lucky to have people from other cities, Air Quality Chicago, Love My Air Denver. They were huge mentors to us. They still continue to help us. So we want to also pay that forward as we move on as well. So really quickly, we did a pilot project because you can talk about this great idea that you have, but we didn't know would it actually work. So we ran a pilot and put on some sensors on some schools. We took vehicle counts. It's very boots on the ground. We stood, counted school buses, made charts for how many vehicles were idling outside of the schools. And then we place signage at the schools as well, just to place a reminder to the parents, like, once they see that sign, oh, I've been sitting here for a while, I should turn off my engine. And what we really learned is we saw that there were some city buses that spiked our PM readings that we were collecting. We would walk past vehicles with really bad exhaust systems that would spike it. We had a weird spike with a meteorological event, like a weird wind, a front came in and really switched up our readings. So we were able to get a feel for a lot of the things that could affect our readings that we were collecting. But it was also great for QC because we were able to find that the readings we were taking were correlating well with the purple layers that we will be using. And actually those are correlated with our DNR's regulatory monitors. So we found that to be a good match. So I won't go into all of this, but of course we learned tons of lessons and we're able to learn and grow from that as we head into the work that will start May 1st. And we really hope to continue to improve and learn from each school. We are taking a smaller approach overall. We hope to work with about 10 to 15 schools over the 3-year period, probably 3 to 5 schools each year. That way we can really dig deeper in with each school. We're picturing the school as a community hub, and we're going to really deepen that relationship, not just with the school, but the community that surrounds it. So we have a great network of people set up to be able to do that. And we're really excited to get going on it. So as you can see from this slide, we have lots to do in the next couple of months before we're ready to go with our first wave of schools in fall of 2023. Some exciting things we're working on: toolkits. We're working on tailoring some curriculum because we have so much buy-in from the school system. They are sending their curriculum people to us. They are reaching out to us with their facilities and maintenance people because they want to all take indoor air quality readings while we do our outdoor air quality readings. So there's such good buy-in right now and great partnerships. And really that community engagement piece. So if you were in the session previously and we talked about who cares, like what's the what, but you really have to get that community involved and ask them questions. What do you guys see as issues? What do you want to do about it? What are you struggling with? We are really gonna just create some planning teams, get their inputs, and truly not do anything about them without them. So at that, I am going to close and thank you very much.
Is that a quick question? Carissa, you want to say?
Oh, yes.
Oh,
Yeah, so I'm on the Regional Air Pollution Advisory Committee here for St. Louis, and one of the really similar programs that's been successful, but they work very closely with the American Lung Association. I don't know if you touched base with them. Another thing, poverty and pollution. At St. Louis University, there is a big Jesuit movement with the Pope, the poor affected most by pollution. Maybe contact Marquette University. They would be interested also.
Yes, wonderful. So ALA, we have representatives from the American Lung Association on our Wisconsin Asthma Coalition who are deeply tied into all of this. So we do definitely have that. And that's a great recommendation. We have a professor we're working with at Marquette. And also we're looking to work with some other faith-based organizations. We have some very active congregations in Milwaukee, active in social justice and things, projects like that, that we want to pull in as well. So thank you for that.
thank you. Okay, we're gonna have more time for questions and answers later. So next, we're gonna move on to Bonnie Ford from CSU. Bonnie, take it over.
Great, thanks. So I'm going to talk about health impact assessments a little bit more broadly about how we do them, give you some examples of them, and talk a little bit about NASA data role in doing health impact assessments. And I want to give a shout out to the people that I work with, especially Cheryl Magsamen, who's an epidemiologist at Colorado State University. So I talked about landscape fires. So just this kind of general background, we know that wildfires and landscape fires are a large source of pollutants with gases and particulate matter. they're a large part of the portion of the primary PM 2.5 emissions in the US. And so as these sources of air pollutants, they have impacts on human health. This is the EPA's kind of pyramid of effects where we can look at the proportion of the population affected, with these kind of subclinical outcomes and versus all the way up to death, which may have a small impact, but air pollution has a lot of health impacts. And specifically studies that look at exposure to smoke have found similar outcomes as these general air pollution studies. And some studies have even suggested that smoke may have worse health outcomes than general anthropogenic pollutants. The tox of it is a little bit stronger. So we often really want to quantify the impacts of these emissions on health across the population, and the motivation may be different. We might be trying to think about how do we allocate our resources? How do we motivate policy change? How do we assess potential impacts of future changes? We might want to analyze competing interests. How do we quantify these differences when we're thinking about preserving ecosystem health versus preserving human life versus how much it costs to suppress fires? And so health impact assessments can be used for this. So I'm going to start off with this example of a health impact assessment that we did. So we know wildfires are increasing in frequency and intensity in the Western US. This is from a Westerling paper, just showing that the number of large fires has gone up. The cost of fighting fires is going up in the US. And the concentrations of smoke are also increasing specifically in the Western US. So this is from work by Caitlin Odell. And so we want to think about what is the total burden of the health impacts associated with exposure to smoke in the US. And this can lead to some other questions too about where and when these impacts are the largest. So looking at the smoke concentrations in the US with the epi literature, we can try to calculate what the attributable asthma emergency department visits are associated with this exposure. I'll talk a little bit about how we do this in a bit, but we can use this to understand where these are happening. And so these are separated. This is for every year here. Along here, and we have it colored by these different regions. So the darker colors are the Western US, and the central and the Eastern are in these lighter colors. And if you're looking across these years, you actually see that the Central and Eastern are having a lot of these health outcomes. So that's really important for messaging. There's large populations, they're getting transported smoke in these regions. We can also look at different sources. So if we compare, we know what the total PM 2.5% of mortalities. Those are really going to be located in California and in the Eastern US, where we have a lot of anthropogenic sources. If we're just looking at smoke, where is that occurring? It's going to happen in the Pacific Northwest, where we have a lot less anthropogenic sources, and we also have a lot of smoke. So it helps us again with these kind of messaging and thinking about where are we putting our resources, our health resources. You can also use an HIA framework to try to look at what's the future change. So this is a study we did several years back where we were looking at output from CESM and projections into the future. And you can see that the average total PM 2.5 concentrations are decreasing over time in this projection, but the fire, so this is the PM 2.5 that's attributable to smoke, is actually increasing. And so all of the benefits that we're getting in decreasing our anthropogenic emissions, a lot of those are being offset by the end of the century and because of the increase projected in wildfire smoke. So again, trying to think about what can we use that information for. So I'm showing how health impact assessments are useful, but I want to talk a little bit about how we do health impact assessments and what's the process and the role that NASA data. So just want to talk about what exactly are health impact assessments. And so they're using epidemiological evidence from studies, specifically on air pollution for this, obviously on other studies as well, and health to identify and assess pollutants and suggest an overall health impact on the population. And the motivation is really crucial. So why are we trying to calculate this burden? I talked about different motivations that there might be. Traditionally, they're really used for decision-making. And because of that, it's really best to do those health impact assessments in conjunction with the stakeholders that are going to help clarify the motivation and help us understand some of the methodology we might want to use. I'm going to take a little detour and get up on a little soapbox that HIAs are not epidemiology studies and talk a little bit about that difference because sometimes they get a little bit mixed up. So this is a lot of text on here, but epi studies analyze the relationship between an exposure and a specific health outcome, they're going to hypothesize, but not assume that there is a relationship. With an HIA, we're assuming a very specific form of the relationship between the exposure and the health outcome. And so to do a health impact assessment, we have to know that there is enough epidemiological evidence in order to do that health impact analysis. In epi studies, again, we're going to study a specific population, a region. We're going to try to look at different population risk factors, control for confounding variables. And then we're going to look at potentially how that relationship is changing at different concentration levels. We might be looking at lag effects. So the lag effects of you're exposed today, what's the health impact tomorrow or the next day? Health impact assessments are going to really apply these relationships broadly. Rarely do we use concentration response functions that are for different age groups or genders or things like that. Again, health impact assessments don't provide evidence that exposure leads to a specific outcome, but they can give us an estimate of the total impact across a population. So what kind of goes into our health impact assessment? So we have information on populations. We need a population data source. We need information on the exposure concentrations, the health outcome rates, the baseline, and then this concentration response function, again, that comes from epi studies. So HIA calculations, they're just basically math, but you need a lot of guidance from the epi literature. So this is just kind of one form that we use, but you need to decide your specific health outcomes that you're looking at. Are you looking at hospitalizations, death, et cetera, like that? The exposure timescale, are you looking at chronic exposure? Are you looking at acute exposure? There's different response functions for those. You need to determine your spatial resolution. That should really be guided by the resolution of inputs. And your choices really should be driven by what is in the epi literature. What are the studies have shown that there are the health effects that are associated with those exposures? So talk a little bit about difficulties in conducting HIA specifically for landscape fires, but I think of these more as like opportunities for us. So this is an example for our Tiger team. We were looking at fires. These are agricultural fires, prescribed fires that happen in the Flint Hills of Kansas. And you can see this is the burned area here. And then these are the sensors, the air quality monitors, which are not in this region. So it can be really hard to assess exposure in this region. This is where you can have a combination of satellite data and some other surface monitors that can really help. Separating out sources can be difficult. So if we're looking at just smoke exposure, how do we separate out that from anthropogenic? And we've done that traditionally by using satellite data together. Another difficulty is that we're still limited in the epi study. So the literature isn't clear what the chronic exposure health effects are. We have to kind of borrow those from anthropogenic studies, and those may have different the functions might be very different. We also have knowns in the epi literature that we don't account for, lag effects or potentially differences for population risk factors. So I think just finishing up with the promising role of NASA data for HIAs, I think just trying to motivate youth, how can we do health impact assessments using our work? They help motivate concern for air quality. You might see a small little risk in the epi literature when we're thinking about one person, a little bit of concentration, but it's very, when you do it for a whole population, it's very motivating. We get population data, we get exposure data from NASA, and they can help fill in a lot of the monitoring gaps, both by using the satellite data and then also all of the studies that are being funded for community and citizen science. With our Tiger team, we put up a whole bunch of monitors. These are small, low-cost monitors all over this region here. So we have a better idea of what the satellite is saying and how we can combine those. New satellite products. Everybody's so excited about tempo. That's going to give us such a good the spatial and temporal variability. So again, we can use NASA data both to improve our exposure estimates here, which can be used for epi studies. That's what we've been doing at CSU. And then this helps us then do better HIAs as well, which can be used for decision making. So really promising role that we can do together. So great.
Thank you, Penny. Any questions? From Hua. Right, our next speaker is Amber Soja. He's a HAQAST member here from NASA Langley.
Thank you. And thanks, Bonnie, for setting us up. I'm part of that team, the HAQAST team, or the Tiger team, and also with Jeff Pierce, who you heard speak earlier today. And we're bringing up slides. Basically, I'm going to talk about the science that we bring to these data. And I hope that this gives you an idea of what we can do overall. And with that, then we'll have better discussions this afternoon. And hopefully you'll have some ideas for me of what you'd like us to bring to you. So let me figure out what I'm doing here. Nope. Yes. So we all know that smoke is not good for us. And what you might not know, or many people don't know, is smoke in the Southeast is often not well quantified. So that's small fires and prescription fires. And there are many reasons for that when the satellites are read, and also what's reported in terms of prescribed fires. But also they're equivalent to the amount of area burned in the Western United States in a normal fire year. And we focused on the Flint Hills, as you've seen earlier, or this talk will be focused on the data from the Flint Hills. So if we look at the MODIS burned area product, and I don't know, is the top one going to be the pointer? Okay, in the top right, this is the MODIS burned area product. So what we can see with the MODIS burned area product is when most of the area burns in the Flint Hills over time, and that's in April, but also with ends in March, April, May. And then with the fire detection data, completely different product. It's the same kind of scenario as you see when the fires are burning most of the time. So that's one analysis. And then what we ended up doing is we looked at the landscape scale fires. We looked at high to very high resolution data in order to determine what we could really see with MODIS data. So we looked at before, during, and after fires so that we would get the timing the same. And this is what we did. We hand digitized these. So you're looking at two separate fires. Top is named Up, the bottom is King Peñiental, and their time sequences. So this is pre-fire, right after the fire, and just a few days later. So often either the landscapes green up, they're plowed, wind blows the dirt around, but they're gone within a couple of days with a lot of these small fires, making them very challenging to detect. And also they burn at times when the polar orbiters are not overhead. So early morning, late afternoon, when the relative humidity is highest, because farmers really know what they're doing, or people that have rangelands know what they're doing. So I'm just going to toss out results so you can see what we see really quickly. And in the top right, you're looking at a comparison between the detections and the burned area. And on the bottom, you're looking at the number of detections of burned areas that we can find on the landscape. And what's really important here is over 50% of these fires are not detected by active fire detections. And that means that they're not in the burned area product as well either, because it takes both. So what we found is most of the large fires you can see with satellite data, but it's the larger fires that you can't see. That's 8.45 kilometers squared is the median of is the average detected size. And the burn scars that we are able to look at high resolution data that don't have any detections are about 0.5 square kilometers. So we also looked at what's intersected, and this is a large fire, so it's a large small fire. So it's going to have a better relationship, and what's intersected, meaning that what we digitized and what you can see from the MODIS product is the same. So that's intersected in yellow, and that's 76%. And what's omitted in arrows is 10%. And then what MODIS detects that actually really didn't burn is commission error, and that's 14%. But if we look overall, the intersection is only 65% if we're comparing the high and very high resolution data to the MODIS data. So that's what we can see from space. Smaller fires, smaller fires under 0.75 were not recognized by the burned area product. And most of the area was omitted, not necessarily because you couldn't see it with the MODIS data, but because it was overestimated, so it was characterized incorrectly every time. But if you ignore time constraints, because we were looking at space and time and different data products, then MODIS can see 68% of the area burned. We compared very high and high resolution data. So to ask, how small do we really need to go? So with the planet data, the 3-meter data, and the Sentinel 10-meter data, there really isn't that much difference. They do very well. So we don't have to always go to planet data, the 3-meter data. We don't get that much better if we do. We also compared the Sentinel data, our product, our digitized, hand digitized product, with the Kansas Department of Health and Environment data. And this is what's given to the EPA. So this is the National Emissions Inventory data. And they do a really good job of characterizing the fires. So better than the MODIS product, but they put a lot of detail into their area to get the right answer. So next we looked at the horizontal kind of smoke, and this is a NOAA HMS product. And if we were looking at the smoke that was characterized, you would think that May or the whole time, February to May 2022, was a very bad smoke year in comparison to 2021 and 2020. But that wasn't what we were hearing. So the first thing we did is we got rid of these fires that were coming from other places, and they were over the Flint Hills. So we just took those out of the analysis. So what we found when we did that is 2022 was a pretty normal fire year, greater than 2021, but not as big as 2019. So it was a normal fire year. And if you just looked at the horizontal data, that would not have been the answer that you found. So you actually have to look at the data, that you understand your data and look at it in a little more depth. The next thing we did is we looked at the vertical, and you can see the vertical extent through the atmosphere with Calypso data, and you don't have to be right by the fire to see it. And I think that that's a little bit of a miscommunication. So you can see downwind of the fire, and you can tell how much in the atmosphere and where, and often it's overhead as well. So we heard from our partners on the ground that it was a really dusty year in 2022. So what we did is we looked at the Calypso data, and on the left-hand side, top in the middle, not in the left, but the middle, is a vertical feature mask. And that's showing the aerosols that are in the air. And then from the bottom of the atmosphere to the top, and then on the bottom in yellow is dust. And so it's mostly dust that's in the horizontal, and the vertical of the atmosphere. And people were reporting that it was a very dusty year. So this is consistent. And on the right-hand side, you can see the HMS product in gray, and blue and red detections from MODIS and VIIRS, and the flight track of the Calypso data. So we put all the Calypso data together for all the years. We can see that indeed was a very dusty year, 2022. It was the dustiest year in the Calypso record, and polluted dust, which is likely smoky dust, and smoke were not that high in comparison to other years. So it was a pretty normal fire year, even at the surface. So next we took apart what was at the surface and overground, at the surface and above. And what we find that the dust is at higher altitudes. It's not actually at the ground, so it's mostly overhead. And smoke is pretty normal for this year. So you can take apart the horizontal and the vertical and the fire detections and the burned area, and you can put this all together to tell a story. And that's what I have, is the different types of data that NASA has. And I hope that this gives you ideas for what you might want to use for any of your assessments, and we'd be glad to hear from you. Thanks.
Thank you, Amber. Any quick question?
Amber, you showed that for the ag fires or the Flint Hills fires, that satellites collectively only saw about 50% of them, but you didn't include any geostationary measurements there? What's your sense of whether it's just the timing of when the overpass is and the short duration of the fire?
From other data, because we've looked at this with fire CQ data, I can say that depending on how far away we allow the geostationary satellite data to be, so we can say, okay, within 4 kilometers, that's probably a fire detection. So we'll accept that, and goes by far, finds the most small fires. And even when it was 4 kilometers by 4 kilometer data, it still characterized the most small fires. And that's because it's overhead. It's simply because it's overhead. Even when it was, 15 years ago before we had the ABI instrument. So GOES does a much better job.
Thank you. Our last speaker, okay, we'll get back to you. Last speaker is Byeong-Uk from Georgia DCB. He's also an ambassador of HAQAST.
All right, thank you, everyone. Today, I would like to share what we have been working on since the last meeting, and also kind of new venture, or the venture, I should say, that we are getting into. See, so before we begin, I would like to share new development happening at the regulatory community, that now we have a proposed PM National Ambient Air Quality Standards. Now the rule that's looking for the comment, actually the comments period, I guess, ends now, that they say that it's going to be somewhere between like a 9 to 10 from 12 as the annual standard that we have now. And just to let you know that 10 micron per cubic meter is the only value that all the CASAC member agreed, all 7 members. And there is a little bit of diverse opinion about the other numbers. And then the rule proposed that the agency would retain the 35 micron per cubic meter as a 24-hour standard. Now, what it means when it comes down to actually implementing it, that's part of the story that I want to share today. This is the map that's showing the location of the PM2.5 monitors that we have. We have a fairly good coverage thanks to our ambient monitoring program. It's working really hard to get a very high quality data. And this is a graph showing time series, basically showing the daily PM2.5 design value trend. And you can see that there is a pretty good downward trend, except a couple of bumps there, that we have some regions like one of the value that up in the 2016 and 2018 3-year average value that became design value is because we have a big event happening in 2016 and 2017, kind of driving that high, based on the some events like wildfires and Saharan dust and stuff. And then the annual design value that you can see that showing a pretty good consistent downward trend, except when it comes down to somewhere around 2019, that you can see that it starts ramping up. And we think part of it is something that I will discuss right next to it about the type of monitors that we are using for the regulatory purpose. Just to let you know that what we have to do as a state agency once the new standard promulgated is that we need to make a recommendation, and then EPA will make a final designation, which will be likely based on the 2020 to 2024 data. And then once the some area are designed, if they are designated as a non-attainment area, then we need to work on an attainment SIP to EPA for its approval. And we have 18 months after effective date of the designation. So you can imagine how busy we will be if that happens. And also we need to submit what's called the infrastructure SIP, basically the state plan that proving that we have infrastructure to implement the other program. That's actually due 3 years after effective dates of the next. So it will be pretty busy years coming in. The other things related to the transportation and general conformity, many of you may not be familiar with these two things. but basically the general conformity meaning that if you have any federal funding, then you need to prove that or have a plan to say that it's not going to hinder any of the air program to improve air quality. So that's kind of in a nutshell. And then we have a permitting requirements changing if you have non-attempt material. One thing that I can emphasize is that NOx, VOC, ammonia is not really considered as a significant precursor, at least for Southeast or Georgia. But once it gets the non-attempt material, then you got to prove actually through the photochemical modeling, which is pretty big project, that they are not really the significant precursors for the PM2.5. So the last line, that it has a significant impact for the area that's going to be designated as non-attempt area. Because of that, and also the other things going on, that we made comments for proposed PM2.5 next. One of the really big thing is about comparability issue, which is really well discussed, well known now. That on the right-hand side, you can see actual EPA page going through all the data comparison between the FRM monitor and FEM monitor. FRM monitor is filter-based 24-hour sampling, and FEM is continuous hourly. And you can see that there is a little bit of drift in this particular monitor, that we are seeing a 15% high bias in the FEM monitor. So in a comment we proposed actually the bias adjustment approach that we may be able to use if it is agreed. And also we made a comments about how we think it would be helpful to do the PM exceedances and exceptional events based on other information. So for now, we reclassified some of the three high reading FEM monitors and non-regulatory monitors and start doing co-located sampling. So we'll have more data about compatibility. There are other comments that we made. If anybody interested in, I believe I can share it because it's already in the docket. Now, this map shows on the left-hand side what would happen if we just go with whatever the data that we have. Fortunately, with our monitoring folks are working really hard, we already certified the 2022 data sets. On the right-hand side, you will see what it would look if we apply our proposed bias approach. So, and you can see that, you know, if we ever been on like an even 9, that you will see a lot of red still, even after the adjustment. Now, the exceptional events, in my unit, we have to develop something called the extension report whenever there is extension happening. And we had 37 extensions in Georgia in 2019 to 2021 timeframe. And 25 of them, we believe, are caused by prescript burn. And one of the other kind of sort of last comment that we made was the significant determination, which is a big component for the exceptional event demonstration. We think that shouldn't be limited just for level of 24-hour PM2.5, because obviously the annual is 12 as of now. So that's what the report overview that I mentioned. Due to the time that I'm not going to get into too much details, but you can see that in the second bullet that we have a lot of information already contained in. We got to do it in a 3 business days. So you can imagine how busy we are once that happens. It's like you have to watch kind of tornado watching in a sense for us, that even over the weekend, whether we have extents or not, then we got to ready to write the report. This one shows one of the product that we are using. It's a Go 16 true color image, and I put the red fires symbol there and the yellow star, that's where the monitor is. We have been using slider product from the CSU that it's been really helpful, and they generously extend the archiving days. Initially, it was like 5 days, I think. Now it's up to like a 6 day or something. So it's been very, very helpful. So this is kind of evidence that we want to use in our exceptional demonstration, the exceptional event demonstration, that, you know, obviously in the daytime, you can clearly see the plume hit the monitor. Now, there may be some question about, well, what happened in the ground? But to me, if you combine with the time series, I don't know, you can tell me that I think this is a pretty clear shot in this case, that you can see the spikes of the signal in a FAM monitors, by the time that actually you see it literally, goes true color that the plume hit the monitor location, and then it dropped down. So just in case, if anybody else is asking a little more information, then maybe Tropomi as a snapshot can be used if it happens at daytime. So we got it, and this is one thing that I was a little impressed. Well, I guess should say more impressed. Tropomi NO2 actually captured pretty well, oftentimes, sometimes better than maybe the true color image too, that NO2 from fire was really well captured. So we would think that this would be sort of the additional evidence that we can say that instance was caused by fire. And then I looked into the day fire products on the slider side. The one thing that I want to point out is, about 2 hours, you can actually see the fires are gone. Part of it is there is cloud, and also many of our fires are prescribed burn that's really planned, and then it's sometimes below canopy and stuff. So it's smoldering many times. So depending on the detection method, you may not be able to see it from the satellite. So there's another example that to me is very obvious. So this is the one thing that I'm hoping for, that, really simple information and very clear evidence that we can get some approval from EPA for the exceptional event demonstration. So the plan is we want to develop the exceptional event demonstration, and which is much simpler. Let me emphasize that, because I don't want to get into, hopefully not 100 pages per instance, because you can see that we had about 30 instances, 3 years. That means translating into 3,700 pages. And I don't know whether that's really the route that we want to go. But at the same time, short-term goal is, again, to come up with a relatively simple and easy case and work with the EPA about what would be acceptable. And then, long-term, that we want to streamline, like Jay Baker's talk in the last HAQAST meeting, to come up with a more efficient way to handle these kind of instance cases. Now, here is a wish list for the satellite community. You can tell that I manually put the fires and those things. So eventually, I want to have some sort of the way to upload my customized data to the place and overlay with the satellite product on the web interface or whatever, not necessarily getting into the sophisticated programming, even though we can, just not really efficient for the purpose of regulatory agency operation. And part of it is also, we have been working with the Georgia Forestry Commission to get their fire permit data. It would have been really helpful if we can overlay that data, even kind of semi-manually, on this GOES 16 true color image or anything else. So if you have any idea, suggestion, I will be more than happy to hear and learn. So that's all I have. Thank you.
Beyond. I showed them. Well, actually, that's good. Yeah, go ahead.
Just a quick point of clarification. Thank you for that very good presentation. I'm a little surprised that so much of your exceedances are due to prescribed burning. I think you mentioned you have a smoke management plan.
Right.
Don't you guys have a permitting program and also no burn days so that you can manage those impacts?
Yeah, but at the same time, you never know where wind is blowing next day, even if you can predict it, right?
Well, but I mean, that's a robust smoke management plan, right? That you try to.
I would say our forestry partners are really working hard to try to prevent this kind of instance as much as they can, but at the same time, it's matter of, I guess, at the end of the day, a matter of whether you burn a lot more things later by kind of displaying it or spread out over the days. So I don't know whether the plan is not really.
Do you require on-site mitigation measures when you're burning, just in case, so that you avoid uncontrolled events?
I might have to defer to my first partner about the detail. But I do know that we have a agreed plan between our air agency and the Forestry Commission. It's just that like I said, that, actually the emission, the animation that I showed you, you probably noticed the wind blowing at the, around the, I guess near the surface, the blowing this way and the cloud coming the other way. So there is some, complication in the wind pattern in the area.
Thank you, Brian. I would like to invite all the speakers in this session to come over to the front. Unfortunately, we only have 4 chairs. We have 5 speakers. Okay, thank you. Maybe you can scratch. Yeah. Okay, so we got 25 precious minutes that we can ask your questions.
I'm glad Alberto just asked that question because I was like, I'm just fascinated. I've for a while been fascinated by difference culturally on the thoughts on prescribed fire between the Southeast and the West, and California obviously being a big example, where it just seems like the Southeast prescribe burns so much to the point that they have air quality issues, but then they rarely have wildfires. And then it's an issue in the West, often getting public support, is my understanding, for prescribed burns in many locations. And then we have wildfires and obviously different ecosystems and different reasons for doing it. And so I'm just kind of interested in getting people's thoughts on balancing ecosystem cultural roles and air quality issues with prescribed burning. And that's sort of where we all fit in with that, and how we approach our knowledge on air quality when coming into issues of prescribed fire, where there's many, many, many different aspects and how people care about it.
This is one of the response that I'm kind of be careful, right? Because it's recorded. But at the same time, the kind of my perspective is, like I shared a little while ago, when you control with the little fires and barely over, say, NACs in a certain range, I mean, a certain extent, and you kind of confine it and around your monitor, right? When the wildfire happened, like something happened on the western side, it actually, there is some argument that it actually traveled over to the New York. So I think that's one aspect that we can see, that how you want to kind of manage the extent of the effects in temporally and spatially. So that's, I guess, one aspect.
Say something. That was my question too, for the audience, because, in this area, I can be controversial. And that's, I mean, we burn a lot in the Southeast, but we don't have the wildfires. And we need to actually put more good fire on the landscape if we want to avoid the extreme ones that are the most costly and causing the damage. So, and that's everywhere. And we need to, like in the Flint Hills, when we were looking, they know what they're doing. They've been doing it for generations. If they don't, they lose their, they can lose their homesteads, they lose their ranches, they lose their cattle. It's very emotional, and it's something that they do together. But can we offer ideas perhaps, and I'm not an expert at this, how we can keep air quality and PM down? Perhaps they extend it over a little bit of a longer season. Maybe an off-season burn, we could do that, and it could become cultural something. So there might be a way that we work together on this. But across the landscape, and this is the controversial part, and I want to hear from all of you, we need to figure out a way with EPA to get more smoke and fire on the land, more fire on the landscape, not necessarily smoke, at nose level, but more fire on the landscape. How do we do that? How do we get the EPA to think about this? Is it a different way to think about exceedances? I don't know, but to get out of the mess we're in, we need more good fire on the landscape. And so that's pushing it a little more controversial, but same thing. Go ahead, be mad.
All right, I have a question from the online audience. Malcolm Zachariah would like to know, how often does Calypso go over the Flint Hills?
Not that often. It's only 100-meter swath, so it's not that often. And so when we put together that data, we took, with the year, but we could do it by month as well. And we should be talking with him soon. Actually, he has a poll to talk with us now. I believe he's on a poll. So we could have that discussion. It's not that often, but even if you get them downwind, you can figure out about what it is. And it's Calypso is going away soon. It's way past its lifetime. It's a backscatter LiDAR, so the subtype is not perfect. HSRL would be. We would be able to look at subtype and used in by the EPA as well, rules and regulations, but we're not going to have one of those in space anytime soon. Brad wants to say something and he'll give a really good answer, I'm sure.
You pass the mic, Brad.
I got it.
So yeah, Calypso doesn't pass over a point very frequently, but there's other alternatives, like let's have a network of deployable celiometers that go to Flint Hills. You know, EPA, I think, they put celiometers at Flint Hills specifically so they can look at, you know, what's the altitude of the plume and things like that. So there's other approaches other than satellite-based applications.
Yeah, they have a lot of studies, published ones too. Yeah.
Thank you. So I want to ask a question to our Wisconsin colleagues, but maybe if I may answer Amber. And I think I'm speaking for all my colleagues in California who run air quality regulatory agencies. We absolutely agree with you. Prescribed fire burning needs to be one of the solutions to deal with wildfires because our biggest issue in the West is way too much fuel. And one way to deal with it is prescribed burning. But my point, and again, I come back to why I'm a little surprised, is if you have a robust smoke management plan with the right sets of checks and balances, that should not be a reason for exceeding the air quality standards. And I think that's the way we think about prescribed burning. But my question though, congratulations on what you're doing with communities, because it sounds very familiar to me because we've been under legislative mandate implementing something we call community air protection since 2017. And I'm glad that EPA is looking at that and implementing air quality monitoring at the community, empowering communities with data. But my question for you guys is this. I know you said no interventions. What we learn and find working in our environmental justice communities is communities don't want to be monitored to death. They want solutions. They want actions that are actually going to reduce the disproportionate burden that those communities see. So I just wanted to kind of get your thoughts in terms of a couple things. One, you know, when does the planning for emission reduction strategies begin? And then probably the toughest one, because you mentioned redlining. If there is one thing we could do to improve the burden of communities, is try to solve the issue of incompatible land use. And that is not an air quality thing. So how do you leverage what you guys are doing to actually begin to change the way that we have developed our urban centers that are leading to these disproportionate impacts?
So I'll start and then I'm going to let Erika comment as well. So while we stated that the grant application was not supposed to focus on interventions, we definitely snuck some in there. We're going to, obviously the anti-idling work. We're talking with bus companies, making sure that all of their contracts with the cities contain verbiage that they need to turn off their buses. We are looking at the public transportation, the city buses that run down the streets that pass right by these schools. We are looking at where the playgrounds are located at these schools. Are there playgrounds right in front, right off that main road? Is there a way while they're taking on, some of our colleagues are looking at these regreening the play yards, and we scoot it behind the school at the same time? So there are so many different things that can be done. So I agree. We don't want to talk to the communities and be like, we're just going to look at this. That's not what we're aiming to do either. We're going to come up with plans and steps. And while it might not happen within that 3-year EPA grant, it's going to build a great foundation for that, for steps that we can take moving forward. And I'll let Erika weigh in as well.
Sure. Yeah. I just to piggyback on what Carissa said about like city buses, that would be a great opportunity for our school district to partner with the transit system in Milwaukee to say, you know, this would be a great place for a hybrid bus or a electric bus on these routes. Because we saw in our air monitoring, we also, I mean, we had our purple air monitor and we also had dust tracks too that were mobile so that we could, you know, check our readings and correlate them. And we saw time and time again that the city buses were the ones triggering them, not the school buses, but the city buses. So, you know, as we transition to clean energy, those are the kinds of things that we need to look at. I have a whole lot of things to say about action because I've been working with communities since the early 90s on a lot of different environmental justice issues, from air quality to pollution cleanup and Superfund sites. And yeah, people are ready for action. Wisconsin is about to launch their version of the environmental justice screen based on California's, largely your methodology. And so we've had a lot of public involvement and advisory committees, listening sessions, virtually and in person, community conversations, one-on-one interviews with community members. So we heard that, and it wasn't a surprise because we know that they're ready for action. So it's hard for us to, you know, be presenting yet another assessment tool without any funding behind it to actually get to the interventions. But we're planning for the future, and we're optimistic that that will come with initiatives like Justice 40 and commitments by the current administration in Wisconsin to environmental justice and health equity. So we're going to keep our fingers crossed that this investment in this tool, which is really helpful to have that one-stop shop, will keep going. And I have a question for you, because one of our wish lists is we've been looking at New York State and California using air permits as a way to limit air pollution. And that's something that we'd like to talk with our Environmental Protection Agency, which is Department of Natural Resources.
Is there any plans to do any kind of epidemiologic studies on the, or evaluate it using health data, the impact of your project?
Yes, we're gonna, so asthma is our focus. So we're collecting asthma data through the schools, and also we'll still be continue looking at ED and hospitalization rates and things like that within those areas that we're working.
I also wanted to mention, you know, we call this power partnerships, right? So our state DNR also got the grant, and so they're purchasing one of those large mobile monitors. So we're actually going to deploy that as well to get more information on different air toxics. So we definitely want to study that as well.
Do you have questions?
Unless you're gonna do the online.
Oh, you can go ahead and we can move on.
So in this discussion about fires, a lot of potential comments about the prescribed burns, and that when it gets up to Maryland from Georgia, it's usually not over the standard by that point, but we can certainly see the impacts of the smoke. Should we be messaging something different to the public? Because all forecasts and all messaging are based on the NACs. Should we change the way that we message to the public to reflect a wildfire event versus the PM itself?
Very good question.
Okay, then how? I mean, yeah, go ahead.
There's a few different components of that when we think about messaging, right? I think one is, you know, and how we try to get people to be more aware of pollution. It can be a little bit different. You know, when we're getting transported smoke, we find in Colorado, people may not recognize that it's smoke a lot. Jeff talked a little bit about this. By the time it gets transported, it doesn't smell like smoke. So people don't recognize that there is smoke. So I think there needs to be some messaging change around that. Just in general, talking to people about checking your air quality is a really important thing. For, protecting against health, I mean, the recommendations, right? Reduce your exposure. How we reduce our exposure, that's going to be dependent on the resources that are available. We've really been thinking about this because of these maybe, low levels, is that usually when there's a smoke event that's really big, we get really good messaging, right? There's a fire nearby, we're going to talk about it if it's red, but we should be trying to get people to change their behaviors when it's in the yellow, when it's in the orange. And so trying to come up with better messaging that targets populations, that it's like, we all should be trying to reduce our exposure, even when it's in these kind of areas, especially working with schools, students. We found we had a fire that was near, near Fort Collins, and they decided, okay, well, there's smoke outdoors, so we're going to keep all the students indoors. But then all the windows were open because it was hot, right? So I think there's kind of these thinking about like, what does that mean, and what are the actual actionable items that we should be taking, and also thinking about maybe some of those. It's hot, so that's going to change some of those. Really high PM exposure in the winter time. Low boundary. I think there's a lot of into that messaging, but I think reducing the amount of.
That's another part of my job actually on the statewide level is communicating unsafe air quality events, larger scale typically, but I really think it's an equity issue too, because a lot of the interventions that we're suggesting aren't available to everybody. And so we're always trying to improve our messaging. People like outdoor workers and so on really don't have the option to get indoors, might not be able to take breaks in the shade in terms of heat health, for example. So that's something that we really need to be cognizant of, providing that range of options so that we can try to find something that works for everybody. But knowing that there are still those populations that are still very vulnerable to the air pollution events.
Good point. I think we have a question online. Better
I believe they're more just comments.
comment.
Yes, but would you like us to read them?
Yeah, please.
So Michael Geigert says online, CT had an exceptional like ozone event due to the Flint Hills and Southeast fires. Record heat and transport were perfectly aligned. It would be difficult to prove exceptional event with so many fires. Do you have any thoughts on that?
I can make a little comment on it. What I realized. Yeah, that as of now, I think the EP guidance is requiring, giving information about how to file the exceptional event demonstration. And one of the things is clear causal relationship. I think oftentimes that's why some of the wildfires are harder actually to get the approval, because on the way in a long transport that you start getting other things. Although major may be one of the wildfire, but if you start having other fires joining in, then now what does it really mean by clear causal relationship? Does it mean that you have to point your finger to one fire, or in fact, I think the guidance is saying also that you got to have a sort of unique ID for each fire. So yeah, I agree that maybe that's one of the points that he's making, that once you have a multiple causal elements, then it's actually harder to do it. So that's why I'm also hoping for in our case that you can see that it's a nearby fire, so that we can actually show more clear causal relationship without going through too much complicated analysis.
Can I add to that one? Hi, Michael. That's a good point. He tried really hard to get that exceptional event in for a long time, for many years, and you just couldn't. So that argues for the more conversation with EPA. So this is their big wildfire initiative now, and also the Wildfire Commission, where all different agencies are working together to come up with reports. And so the EPA should be at that table, and they are. But I go to a lot of fire conferences. It's my main thing. If I go to a strategic management conference, invariably there are people from California that are at national forests, and they're like, we have 6 weeks of a window. We can't do it. People are taken for 2 of those weeks because of these other wildfires in other parts of the country. And then half of those days we can't do it because if we did, it would lead to a smoke exceedance. And the EPA people are saying, we don't tell them they can't burn. It's like, but the exceedance makes it so they don't have to burn. So even there's many EPA people that aren't even aware that the rules actually affect the amount of time. So it comes down to days that they can burn. So they don't burn because they can't. And then you have an extreme event that is so much more deadly, even in terms of air quality. So at some point, agencies need to come together if we're going to work this out as a nation. And I think that Michael's bringing up a really good point with the ozone that's clearly from the burning in the southeast and from the Flint Hills too. But he's been on some of our calls and he understands now that they really have to burn. So it's challenging.
Joe has a comment.
I was just saying they're clear. So I'm familiar with what Michael's talking about. There were over 5,000 fires picked up by VEERS, just by VEERS, between basically the East Coast and the Flint Hills over the course of about 3 days prior to the exceedance event. So the clear calls, I think it's clear that some of those fires in aggregate, but if you go through an exceptional event demonstration 3 times in a certain amount of time, you have to come up with a mitigation plan. How do you mitigate 5,000 fires over 20 states? I don't know, but that's kind of the rundown of what we're facing.
I think this session is really running very smoothly. I feel like the easiest one ever monitored, but we are running out of time. I just want to say if any last burning question before we close the session.
Was that intentional? HEPA filters in schools so that kids could be inside. I mean, is that even a possibility? I know there was all this money, and what I hear it going towards is ozone. Just like, what? Why would they do something that's even more unhealthy? Because he didn't have time to look at it, and there's a lot of good salesmen. But is that even a possibility? Especially in places, environmental justice. I mean, if I can afford it, a HEPA filter and AC, I'm okay.
Right. So we are pairing, so the funding went to the Milwaukee Public School District to buy these massive indoor air quality monitors. So again, we're back to like collecting more and more data, but then what's the next step? What do you do about it? So we are going to work with them, co-locate. Well, one will be outdoors, one will be indoors, because we know what's outside is coming inside. And then what they will need though is funding that allows for that, because the funding was very specific to learn more. The funding needs to be specific for solutions. So that is where there are some barriers, and we are working on that. Hopefully that will be the next step. Right now, maybe we're just in the information gathering process, but then we can use this data to really fight for things like that and show the need, like there is a clear need. So that's what we're hopeful about.
A couple more things to add, like that was one of the silver linings of COVID, right? All of the funds that are going to schools for indoor air quality, which is great to see. I just wanted to mention quickly when you said, I have AC, I have a HEPA back. I wanted to share that our climate and health program actually did a project in Milwaukee looking at heat health in under-resourced neighborhoods. And we found that 90%, I mean, this is like one census tract basically. So really small snapshot, but 90% of folks had air conditioners, but about 60% said they were still hot in their homes because a lot of people can't afford the energy bills to pay for them. Wisconsin has some of the highest energy costs in the country. And Milwaukee on top of it has even higher than average costs. So that's a real big issue. However, a lot of health departments do have individual air conditioners available. They do different programs when they get grants. And then we also have a new program funded by Medicaid that covers air conditioners too. And, you know, there are just a couple of states, maybe 3 or 4 that have Medicaid funding for home improvements, for kids on children's health insurance, Medicaid, children's Medicaid, it's called CHIP. So those are some really good solutions, not necessarily on the school level, but I just wanted to share like some of those models are out there and I hope that they grow to other states. We feel really lucky to have ours in Wisconsin. It's just getting off the ground.
Awesome. Thank you very much. Yeah, we like to give another round of applause to our speakers. Thank you very much for sharing your time.